So you look at some examples, NIH, taxpayer-funded institution that we would ostensibly believe is its sole interest is to keep Americans healthy. But 80% of NIH researchers have a conflict of interest with industry, so are getting paid also by processed food industry, pharmaceutical industry. There was a report that came out that 8,000 NIH-funded researchers have a major conflict of interest with industry. So we would assume that would just be clean money from the NIH, from taxpayers, with a singular goal of American health. But in fact, it ends up becoming a PR arm to do scientific research that's mostly focused on pharmaceutical interventions and our standard conventional model of care, which is very reactive and very sick care and not focused on root causes. Then you go to the USDA.
So just to jump in on that, Casey, jump in on that. So basically you're saying with the FDA or the NIH, the people who are looking at our food and what's okay and what's not okay, suffer from the same conflict as the FDA did in Dope Sick, as evidenced by that movie, where the opioid industry got going because the people who were deciding whether that could be safe and marketed as non-addictive or, whatever the initial disclaimers were, they're on the take. They either are getting money from these drug companies, or in the case of the food industry, these big food manufacturers, or they're banking on joining those companies immediately after their government stint is over.
Right. I mean, you see this all the time with the revolving door between, FDA commissioner and then pharmaceutical company right after they finish. Got Gottlieb, FDA, straight to Pfizer. It's just back and forth.
Right.
But it's across every single industry. So NIH, we've got 8,000 major conflicts of interest in researchers. FDA, we've got 75% of the FDA's drug budget coming from pharma, not taxpayers. USDA, we've got 95% of the people who made the USDA food guidelines for America, which come out every 5 years. So from 2000 to 2025, had major conflicts of interest with the processed food industry. You look at medical schools. You've got medical schools receiving huge multi-million-dollar grants from pharmaceutical companies. When I was at Stanford Medical School received a $3 million grant from Pfizer for curriculum reform. So we've got NIH, USDA, FDA, medical schools, all taking money. And then you add on the professional organizations like the American Academy of Pediatrics or the American Diabetes Association, which work to create the guidelines that doctors practice by, and that doctors actually, if they step out of line of what the clinical practice guidelines are, they're at risk for liability. And then these professional organizations are getting a majority of their budget from industry. You've got the American Academy of Pediatrics getting money from Abbott and from Mead Johnson and from vaccine manufacturers. These are the organizations that write the guidelines. So then it's no surprise that you look at the recent American Academy of Pediatrics guidelines for treatment of childhood obesity, and all of a sudden what crops up is that they're recommending as first-line treatment for childhood obesity, GLP-1 agonist injections, weekly injections for kids, Ozempic. And so you just look at every single layer of our government agencies, how doctors are taught and who's making the guidelines, and the money is astronomical what's going in from industry. And that's, of course, going to cloud the way research is done and how we even think about health in the body. So I, as a medical student, and all my peers who go into medical school with this very noble intent to help people and to improve children's health, improve American health. We go to these elite institutions with just wanting to work our butts off. What happens? You enter a curriculum where the science is conflicted. The science that you're seeing at its most foundational level has conflict of interest, where the school has been funded by pharmaceutical industry. The medical school is not getting funded by Big Kale or Big Exercise. They're being funded by Big Pharma, and where the guidelines that you have to learn and memorize and practice by also have a conflict of interest. So what you get is all these doctors who, you start medical school around age 21, 22. You're young, and you're deeply trusting of this system, right? But what you see is that the body is 100 separate parts. You see that what your path is going to be is to go through 4 years of medical school and then pick one of 100 different surgical or medical subspecialties that you're going to focus on just one little part of the body. You see that really what a disease is a collection of, symptoms and signs, and you don't really think about disease until it gets to that place. And then you just need to, figure out what the symptoms are, label the disease, and prescribe a medication or do a surgery. You don't think about proactive health. You don't think about root cause health. You don't think about environmental factors because that's not what being taught. And then you go into your practice and you're getting pressure from everyone around you, from the administrative staff, the bureaucrats, and the billers, to basically see as many patients as you possibly can because you are paid by volume, which further insidiously pushes you to not think about root causes, how to really reverse or prevent disease, because that takes a long time, right? That takes long conversations with the patient. What's easier, what's faster is to see the patient, label their signs and symptoms as a disease, and then give them a drug or send them for surgery. That's what's fast. And since we have this system, this incentive structure in American healthcare that's focused on volume, how many patients can I see per week? The outcomes is not really the thing that we're focused on. So you're taking these incredible, great, bright young minds and putting them into a system that at every level has conflicts that's pushing us to see the body as a collection of separate parts that's inevitable to get disease, and that your job as a doctor is to label that disease and give it a pill or a surgery. And that unfortunately is where we're at, and why doctors, even with the best intentions, are not focused on root causes. There's no incentive to do so, and there's little education.
I think about it sometimes with respect to the very, very wealthy people I know. I'm talking billionaire wealthy. I don't know that many of them, but I know some. And they all live into their 90s. Now, how do they do that? It's because they have an individual doctor who's on staff or constantly available to them. I mean, take the most extreme case, Queen Elizabeth, right? How did she live to 93? Her entire life, she was probably eating clean. She had people around her monitoring things like her blood glucose just to make sure she was where she needed to be on all these things. Full-time attention and care. I think about my old boss at Fox News, Rupert Murdoch, same thing. He's like in his mid-90s, he's had falls and things like that, but onward he trudges. And then I've known younger people who are with the B on the money front, and they travel for business, and I'll see them on a business trip, and they'll have their own food that they've brought with them. And I've asked more than one of these guys, like, why are you bringing your own food? We're at this beautiful event. Like, I'm sure they're going to feed us. No, because they know if they put themselves in the care of just some random chef in some random place, they're not going to get the right beef. One guy I knew, multi-billionaire, one of the richest Americans we have, has his own cows that are butchered on his own ranch, and that's the beef he travels. It's just like there is a level of eating and wellness that the average person has no idea about, but you don't actually have to be a billionaire to get it. You just have to have the information truly in this book, Good Energy, by Dr. Casey Means, and listen to the life changes you can bring on for yourself.
Megyn, it's true. I also see this as well in a community of people who have awoken to this idea that the reasons we're sick in America, the reasons that life expectancy right now is going down in America, and a child born today is on track to live 600 days less than someone who is age 40 right now. Like, this is astronomical. We spend almost 2x more than any other high-income country in the world on healthcare. We also spend 23% of the largest GDP in the world on quote unquote healthcare. And we're not even able to keep life expectancy stable. It's going down in our country. If that doesn't kind of rip you out of your slumber, I don't know what will. And so it's not for a lack of medication, right? We're prescribing medications just more and more. The more statins we prescribe, the more heart disease we're getting. The more Ozempic we're prescribing, the more obesity rates are going up. The more SSRIs we're prescribing, the more people have depression. It's not correlating with the amount of drugs. So there's something else going on that's insidious, that's environmental. And like you say, people who are aware of what's going on are doing essentially everything they can to protect their bodies from the normal inputs that you are going to be exposed to if you're just living in America today. All of these visible
Can I just say,
threats
I'm so annoyed.
us.
Hungry Root is one very easy way to eat healthy. They send you fresh, high-quality groceries, simple, delicious recipes, and essential supplements. It's like having someone else do all the planning and shopping so you don't even have to think about it. Hungry Root gets to know your personal health goals, your dietary restrictions, favorite foods, how much time you want to spend cooking, and more. Then they will build you a personalized cart for the week, including easy 4-ingredient recipes to put those groceries to use. Each order fully customizable. They've got fresh produce, high-quality meat, healthy snacks, and more. Everything from Hungry Root follows a simple standard. It has to taste good, be quick to make, and contain whole, trusted ingredients. Hungry Root is offering the Megyn Kelly Show viewers 40% off your first delivery and free veggies for life. Just go to hungryroot.com/Megyn, M-E-G-Y-N, to get 40% off your first delivery and get your free veggies. hungryroot.com/Megyn. Don't forget to use our links so they know we sent you. Thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.